So we have our 4 samples, that is the sample of fat without any kind of processing, and so we can put the sample on our microscope and we can look at the quality of the fat.
It's okay.
And we can see that in this fat we have a lot of red cells. We have a lot of water. And so it's a contaminated fat. We have a lot of oil because red cells and oil were not removed from the samples. After that we can evaluate the sample of fat made after processing. And we can see that we have a good quality fat cells, and we can see oil drops, and we can't see red cells. So it's a very well preserved fat with good removal of red cells. After that, we can see the fat after injection, after standard injection. The fat cells are still preserved, but we can see a small percentage of fat which were disrupted because of injection. And we can compare this kind of injected fat with 22 gauge cannula with 1 cc syringe with the fat injected with the same cannula, 22 gauge cannula, but with the Lipopen. And the quality of fat is similar to the quality of fat of the manual injection, so we can see big difference really in terms of quality of fat. So the Lipopen allows us to have to inject fat with good preservation of integrity of fat cells, and with a very regular injection. So during injection we don't have a typical stop and go injection problem that we have with the standard technique, with the manual technique, with good preservation of fat cells. So in the conclusion we can observe that by microscopic examination and by glass sliding test, we can observe many advantages in order to use the Lipopen machine.